A dozen hospitals from Maine to Massachusetts are joining forces to give cancer patients more access to potentially life-saving treatment. Good evening, everyone. I'm Amanda Hill.
And I'm Lee Goldberg. Maine's largest hospital group has received a $10 million grant from the Harold Alfond Foundation. They'll launch a network that will link cancer care at Maine Health's 11-member hospitals and one of the world's leading cancer centers in Boston, the Dana-Farber Cancer Institute. Officials made the announcement at the Maine Medical Center Institute in Scarborough this morning. The 5-year grant will pay for nurse navigators to coordinate patient care in a more timely and local treatment closer to home. The network will also give patients in Maine and New Hampshire more access to clinical trials and other procedures such as bone marrow transplant surgery at Dana-Farber. Cancer survivors say having a larger system of navigators to help patients fight cancer is key to successful outcomes.
You have no idea what you're going to do, where you're going to go, and having resources that they can get to easily now is going to make a world of a difference.
And that grant from the Alfond Foundation will run for 5 years.
Now, according to the Maine Centers for Disease Control, thousands of people in Maine every year are diagnosed with cancer. That means thousands of family members, friends, and coworkers are affected by it. Maine is such a large state and our population is pretty spread out, so finding the care you need close to home can be a real struggle for patients going through treatment. So this new partnership with the Dana-Farber Institute is designed to tackle that problem. And joining us now is Dr. Scott Remick, Chief of Oncology. Thank you so much for joining us, first of all.
Thank you.
Now, what sort of services are you hoping to offer through this?
We are offering a commitment to coordinated and highly integrated cancer care, where patients can access their local hospital, and it's incumbent upon us to find the right care, the right place, as close to home as possible.
Dr. Remick, we've done so many stories about Mainers battling cancer, and certainly for the patient, it's unimaginable. For the families, though, as well, how can something like this help these families?
Well, it's tremendous. It's a commitment, really, to trying to keep patients as closer to home. Patients want to know two things. They want to know, can you cure my disease? And the second thing they want, can I get treatment close to home? Those are like the two most important things.
If someone is already a patient with Maine Health, are they automatically enrolled?
It's a system-wide effort, so any patient that we're caring for now is part of this network. This has been in evolution for many years. It was conceived in 2013-14. We've been functioning as a network in 2015, and the Alfond grant just provides enormous investment to accelerate the groupness, the networkness, and the care.
When you get multiple hospitals working together and doctors working together from different places, what does that do for the quality of care for the person?
We're going to be we're raising our care to a higher benchmark. We're going to make sure we have the right specialists in the right locations so patients get to those specialists for their care. And then if they can get back to home for other aspects or components of care, that can be done too.
And if somebody is currently in Boston now, maybe getting treatment now, they just heard about this, can they automatically now come back to Maine, or do they stay in Boston? Or?
Well, we want to be careful where they are in their treatment. I mean, and there are going to be certain instances where we don't have bone marrow transplant capability in Maine. So obviously that's a patient that needs to be cared for in Boston. But the idea is to provide seamless transitions of care, particularly when they're needed. That's what our patient navigation system will allow. That's what our investment will allow. We've already done some testing with that, dry runs, before we went live with the announcement that we have gotten patients back and forth to Boston in a very timely manner.
I think this will be huge for a lot of patients and a lot of families. So.
It is huge. It's a significant opportunity for residents of Maine, for all our providers, and especially for our patients.
All right, doctor, thank you so much for coming and appreciate it. Switching